When assisting a resident with a weak right arm to dress, what should the CNA do first? A. Dress the strong arm first. B. Dress the weak arm first. C. Dress both arms at once. D. Wait for nurse instructions. Answer: B. Dressing the weak side first reduces strain and promotes comfort for the resident. A CNA observes a resident's food tray untouched. The best action is to A. Remove it immediately. B. Ask if the resident feels unwell or dislikes the meal. C. Force them to eat for nutrition. D. Report only at end of shift. Answer: B. Asking about appetite helps identify issues like illness, depression, or dislike for food. Before providing care, the CNA should always A. Close the door without knocking. B. Introduce themselves and explain the procedure. C. Start care quietly to save time. D. Ask another aide to assist. Answer: B. Introduction and explanation respect the resident's right to informed care and consent. Which is the correct way to prevent the spread of infection? A. Wearing gloves for every task. B. Using hand hygiene before and after each resident contact. C. Using sanitizer once per shift. D. Reusing gloves between residents. Answer: B. Proper hand hygiene is the most effective method to prevent infection transmission. When a CNA records vital signs, the readings must be A. Estimated if the resident moves. B. Rounded up for convenience. C. Accurate and documented immediately. D. Written later from memory. Answer: C. Immediate, precise documentation prevents medical errors and ensures data accuracy. A resident suddenly becomes short of breath during ambulation. What should the CNA do first? A. Continue walking for exercise. B. Stop and help the resident sit down safely. C. Call the family. D. Ignore and finish care. Answer: B. Sit the resident down immediately to prevent falls and reduce strain on breathing. Which situation must be reported to the nurse immediately? A. Resident refuses dessert. B. Resident complains of chest pain. C. Resident wants to nap. D. Resident asks for extra blanket. Answer: B. Chest pain is a medical emergency requiring prompt nursing intervention. Which of the following best protects resident privacy during care? A. Keep curtains open for ventilation. B. Pull curtains and close the door before starting care. C. Turn off the lights. D. Ask other residents to watch. Answer: B. Maintaining privacy demonstrates respect and meets ethical and legal requirements. When removing soiled linens, the CNA should A. Shake them to remove wrinkles. B. Hold them close to uniform. C. Roll them away from the body. D. Drop them on the floor temporarily. Answer: C. Rolling linens away from the body reduces contamination risk. A resident's care plan specifies NPO. The CNA should A. Offer small sips of water. B. Remove food and fluids from bedside. C. Give snacks if requested. D. Ignore the order. Answer: B. NPO means nothing by mouth. All oral intake must be restricted to prevent complications. What is the first step in effective communication with a hearing-impaired resident? A. Shouting loudly. B. Facing the resident and speaking clearly. C. Talking while turning away. D. Using medical jargon. Answer: B. Clear face-to-face communication supports lip reading and comprehension. When transferring a resident with a gait belt, the CNA should A. Place belt loosely around the chest. B. Keep the belt snug and hold from underneath. C. Pull hard from the front. D. Hold the resident's arms instead. Answer: B. The gait belt must be secure but comfortable. Holding from underneath gives better control. A CNA notices a resident's dentures are missing. The correct first step is to A. Ignore it until family visits. B. Notify the nurse immediately. C. Borrow another resident's dentures. D. Search without telling anyone. Answer, B. Denture loss affects nutrition and safety. The nurse must be notified for follow-up. Which resident activity could indicate early signs of depression? A. Sleeping slightly longer. B. Refusing meals and avoiding conversation. C. Requesting help often. D. Laughing frequently. Answer, B. Isolation and appetite loss are classic signs of possible depression that must be reported. A resident begins coughing violently while eating. The CNA should A. Slap their back repeatedly. B. Encourage them to cough and call for help. C. Offer water immediately. D. Ignore unless they turn blue. Answer, B. Encourage coughing to clear airway and summon help in case choking worsens. When using a mechanical lift, the CNA must A. Operate alone for privacy. B. Ensure all straps are securely fastened before lifting. C. Move quickly to save time. D. Skip weight limits. Answer, B. Safety checks and correct strap attachment prevent injury or falls. A resident with Parkinson's disease has tremors that cause spills at meals. The CNA should A. Feed the resident without asking. B. Offer adaptive utensils and allow independence. C. Replace utensils with bare hands. D. Ignore the mess. Answer, B. Adaptive aids promote independence and dignity in residents with motor issues. When measuring pulse, the CNA should count for A. 10 seconds. B. 15 seconds. C. 30 seconds, multiply by 2. D. Full 60 seconds if irregular. Answer, D. A full minute ensures accuracy when pulse is irregular. The CNA overhears another aide discussing a resident's medical condition in the hallway. The CNA should A. Join the conversation. B. Report the privacy breach to the supervisor. C. Tell the resident about it. D. Ignore since no harm was done. Answer, B. Confidentiality breaches violate HIPAA, report them promptly. A resident with right side weakness uses a cane. Which side should the CNA encourage them to hold it on? A. Left side. B. Right side. C. Any side they prefer. D. Alternating sides. Answer, A. Cane use on the stronger side provides stability for the weaker leg. What is the best method to avoid back injury during resident lifting? A. Bend at the waist. B. Keep feet close together. C. Bend knees and keep back straight. D. Twist while lifting. Answer, C. Proper body mechanics prevent musculoskeletal injury. If a resident begins to fall, the CNA should A. Catch them completely. B. Ease them to the floor, protecting the head. C. Step aside to avoid injury. D. Pull them up by arms. Answer, B. Controlled lowering minimizes injury for both resident and CNA. A CNA notices the resident's roommate complaining about strong odors. What should the CNA do? A. Ignore since it's minor. B. Provide prompt hygiene care and notify housekeeping if needed. C. Spray deodorizer only. D. Move resident without permission. Answer, B. Hygiene and cleaning reduce odor while maintaining dignity. A CNA documents resident appears angry. This is incorrect because it A. Is too short. B. Uses subjective language. C. Lacks nurse's signature. D. Is in ink. Answer, B. Charting must be objective, describing facts, not opinions. Which task is outside a CNA's scope of practice? A. Taking vital signs. B. Performing catheter insertion. C. Bathing assistance. D. Range of motion exercises. Answer, B. Catheter insertion is a nursing duty, CNAs assist only with maintenance. A resident tells the CNA their family doesn't visit anymore. The CNA's best response is: A. They must be busy. B. That must feel lonely. Would you like to talk about it? C. You should call them more. D. Don't worry about it. Answer: B. Reflective listening shows empathy and supports emotional well-being. Before helping a resident to stand, the CNA must: A. Lock the wheelchair brakes. B. Keep brakes unlocked. C. Raise footrests and push quickly. D. Pull the resident suddenly. Answer: A. Locked brakes ensure wheelchair stability during transfers. Which symptom should be reported immediately after a meal? A. Sleepiness. B. Difficulty swallowing. C. Fullness. D. Burping. Answer: B. Dysphagia risks aspiration and requires immediate nursing evaluation. When cleaning dentures, the CNA should: A. Use hot water. B. Line sink with towel or water. C. Leave dentures dry. D. Skip rinsing. Answer: B. Lining the sink prevents breakage if dentures fall. A resident insists on praying before meals. The CNA should: A. Interrupt to start feeding. B. Wait respectfully until finished. C. Tell them to hurry. D. Leave and skip care. Answer: B. Respecting spiritual beliefs is part of person-centered care.